I'd like to call to order this meeting of the Sacramento County Board of Supervisors for Tuesday, March 10th, 2020. Madam Clerk, will you please call the roll and establish a quorum?
Supervisors Frost. Here. Kennedy. Here. Natoli.
Here.
Peters. Here. Cerna.
Here.
You have a quorum.
Thank you. Would you like to read our statement?
This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. The meeting is closed caption and is webcast at sacramentocabletv.tv. Today's meeting will be repeated Friday, March 13th at 6 p.m. on Channel 14. This meeting is also broadcast live on KUBU Radio on 96.5 FM. A DVD copy is available for checkout from any local library branch. Members of the audience wishing to address the board may fill out a speaker slip and hand it to staff. When the chair calls your name, please come to the podium. Also, please silence your electronic devices at this time.
Great, thank you. If you'd please all rise and join me in the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, good morning to everyone that's joined us today here in Chambers. Again, as a friendly reminder, if you choose to address the board on any matter that's on our agenda or off our agenda, you're certainly welcome to do so. We ask that you keep your comments to 3 minutes, and we have that time limit in place so everyone has an opportunity to address us if they so choose. We do have staff at the back of Chambers that can help you complete a speaker slip. We ask that you please complete that, and if you would, especially for the chair, if you would print your name so I can accurately pronounce your name when I call you to the podium, that would be great. Please give those speaker slips to our clerk, and you'll be called in the order that I received those slips. We do ask respectfully that you please refrain from using profanity to the best of your ability. These proceedings are watched live, and they are recorded, and we know that a number of young people in our community watch these proceedings as a matter of their, in the course of understanding civics and political science and the government here. So we want to make sure that we use appropriate language in these chambers. Okay, with that, our first order of business, please.
Okay, so for your consent matters, items 1 through 25. I do have a note to hold item 7 as the last afternoon item, so that would be after item 36. This would be the contract to approve the Second Amendment to the agreement with Stantec Architecture for professional design services on North Area Recovery Station, the Master Plan Improvements Phase 1.
Okay, so we take that after 36.
Yeah, so 36 is your last timed item for the afternoon.
Okay.
The request is the nature is that this has something to do with the solid waste rates, and that once we do the rates, and then the board should look at it to do this contract or not. Correct.
Okay. All right. Any member of the board wish to pull something off of consent for separate discussion or vote, or to make comments? Supervisor Peters.
Thank you. I'd like the record to reflect I'm going to recuse from item 4, potential conflict of interest.
Okay.
Any others? No. Okay. All right. Please let the record show that Supervisor Peters is recusing from consent item number 4. Is there a motion to approve consent?
So moved.
Second.
Moved by Supervisor Natoli, seconded by Supervisor Frost. Please vote.
Unanimous vote.
Okay, very good. Thank you. Next item, please.
Okay. For your first timed item, your presentation is the presentation of resolution honoring Penny Miller upon the occasion of her retirement from the County of Sacramento.
Okay. Very good. Why don't you join me at the podium, please? Okay. Good morning.
Good morning.
So it's my distinct honor this morning to be in front of the board and the public here. And I'm not sure if you brought any family members or if you have any friends in the audience. You have a photographer too, I see that. But as we do very frequently in these chambers, we are honoring someone that has given of themselves an entire career to the public service of the residents of Sacramento County. In this case, we are honoring the retirement of Penny Miller, who has been with Sacramento County's assessor's office for 36 years. Is that right?
That's correct.
Wow, 36 years doing anything is impressive. She earned a Bachelor's of Science degree in Agricultural Economics and Business Management from the University of California, Davis. She began her distinguished career with the County of Sacramento on November 7th, 1983, as an assistant property appraiser in the assessor's office. On November 25th, 1984, Penny promoted to real property appraiser. While working at the assessor's office, she earned her Board of Equalization certification for real property appraiser for property tax purposes and her certified general license for appraisal in the state of California. She promoted to associate real property appraiser in July 1989, and in March 1990 promoted to senior real property appraiser. These are all, by the way, these are all the whereases in this resolution we're about to present to you. I'm going to go ahead and skip to the resolve here. Now, therefore, be it resolved that the Board of Supervisors, County of Sacramento, State of California, does hereby congratulate Penny Miller upon the occasion of her retirement and extends its appreciation for her many years of dedicated service and further wishes her much happiness in the years ahead. And the podium is yours. Congratulations.
Thank you very much.
I want to say a few remarks.
I just want to say thank you very much. It's been a very long and rewarding career with Sacramento County, and I enjoyed it very much. Thank you.
Thank you.
Thank
You want to go ahead and call the next item, unless there's comments by any board members?
No, I was just curious, what do you plan to do in retirement, Penny? 36 years of doing this, what do you plan to do in retirement?
Well, I'm on to the next chapter, which is have lots of fun.
Okay, very good. Well, we wish you well.
All right, very good.
Okay. Item 27 is the presentation of resolution recognizing March 2020 as National Social Worker Month.
Okay. I think we have some executive staff that are going to join us at the podium here. We have Michelle Calles and Ann Edwards that are going to accept this resolution. Again, members of the board and the public, this is a resolution from the Board of Supervisors recognizing March 2020 as National Social Worker Month. I'm not going to read all the whereases, but I will say that I think everyone up on this dais has a very, very strong respect for the work that our social workers do here for the residents of Sacramento County. I know many of us have done ride-alongs and seen for ourselves day in and day out what they do for the folks here that we represent, and it's a distinct pleasure as chair of the board this year to present this resolution to Ann and to Michelle, recognizing March as National Social Worker Month, and then I would invite you to say a few words if you'd like.
Thank you, Supervisor Cerna. Good morning. Michelle Callejas, Director, Child, Family, and Adult Services. And just some context. So this month was organized as National Social Worker Month back in '63 as a way to encourage public support for the profession of social work. And then in 1984, there was a joint resolution signed in Congress, and President Reagan declared March as National Social Worker Month. And Ann and I spoke a few months ago and said, let's do a recognition before our board for our extraordinary social workers in Department of Human Assistance and Child, Family, and Adult Services. And from Child and Family and Adult Services, I think you all know the role many of our social workers play They are in our community each and every day, attending to the safety and well-being of children, families, dependent adults, and older adults. They provide services and support with excellence, they serve with integrity, and they provide services that allow individuals to live with dignity and respect in least restrictive settings. The work they do is honorable and noble, and for today and this month, we elevate them and recognize their work. So Ann wants to say a couple of words as well.
Just a few words. Good morning, Ann Edwards, Department of Human Assistance. First, I want to say ditto to everything Michelle said. The social workers in the Department of Human Assistance provide a wide variety of functions. They serve the homeless. They help folks that are trying to find work so that they can get off of assistance. They just do so very much. And as Michelle said, it is really noble. It's really hard work. Because you're dealing with people who sometimes are at the lowest place they are in their lives, and you have to be present and engaged, and it can take an emotional toll on social workers. So I'm so very proud of the work that they do each and every day. And we would like to invite the social workers and their supervisors who are here to just stand, please. So very much. Thank you. All right.
Great, thanks again.
Thanks, Dawn.
Okay, we have a number of other morning matters. I am in receipt of 2 speaker slips for off agenda, and I think instead of having people wait, I would like to invite the 2 off agenda speakers to address the board, and then we can move on with our morning agenda. So first is Dan Adderholt.
Morning, Phil Cerna, Board of Supervisors.
Morning.
Morning, Dad.
I'm here this morning. Last time you guys saw me, the last meeting I was here about the 25 feet from the water, American River. And we were misinformed, so I apologize. I was kind of irritated because they were telling us at the American River that it had to be 25 feet from the end of the bicycle parkway. 25 feet from the water, I totally agree with. That needs to be done with our county American River Parkway to protect our water. My American River homeless crews have no problem with that. What we had a problem with is that more than 25 feet would cause my American River homeless crews to have nowhere to go. And they've been the ones cleaning and saving the American River and keeping it clean for the last 5 years, helping Park and Recreation keep it clean and safe down there. So we would like to know if there's any possible way, because we're told it's going to be from the bicycle pathway on, and that's the law they're trying to pass, and I hope that's not true. I hope it'll be 25 feet from the water. We have no problem with that. We agree with that 100%. The water needs to be protected. That's what we've been trying to do all these years, keep it clean and safe for everybody. So that's what I'm here for today, to ask you guys to please keep it only 25 feet from the water law, because we know it needs to be done. And it definitely needs to be done to protect our water system. We agree with that. And also we like to set up a thing where we can help work with Park Recreation and Board of Supervisors, because we like working with you guys, Phil Cerna, and set up a dialogue between me and you guys where we can email each other if that's possible. Thank you.
Great, thank you, Dan. Appreciate it. And just as a reminder, again, this is off agenda, so we can't take any formal action, have lengthy discussion on it. So the next speaker is Ryan Harris.
Hello, good morning.
Good morning.
Thanks for letting me speak and hear me out. I work for Sacramento County, and I'm just here because it's kind of last resort for me. I had brought some of the items that I'm bringing before you today to some of my supervisors, bosses, managers, program managers, directors, deputy directors, and kind of didn't get anything in feedback from them. I was told that because of bringing it to their attention, I run the risk of losing my job. So I'd rather stand here before you guys and tell you guys while I have a job than come here and stand here without a job and tell you guys as well, risking a possible different reaction, who knows. Some of the things that I'm just gonna request is that management be tightened up on, and what I mean by that is that I've experienced a lot of discrimination within the county and working for them. I've worked for them for 12 years, and I've experienced a lot of discrimination while working there, even all the way up from what I believe may be the director's level with our director, Ann Edwards. I tried to notify her of some harassment that was taking place, and in return I got a call from management that said basically I need to let the issue go, and that Ann was requesting a cease on me. Later, to make things worse, she followed up with a discipline for me, and in that discipline, I was disciplined for things such as emailing my father happy birthday. Well, I later realized Ann Edwards had emailed my coworker happy birthday on her birthday, and when I asked about that situation, I received no reply. I was just given a record of discussion and told not to speak of it again. Even with the deputy director, Ethan Dye, he sent out an email speaking on my protected rights and my disability rights. And when I notified HR of it, even to this day, I have heard no reply from HR at all, not at all. And there's just countless other things. I'm trying to keep it to 3 minutes. There's just countless other things. We're told to sign off on security policies. When you look into these policies, they don't even exist. In 10-25, it says to go to 12-24. There is no more 12-24, but we have to sign off saying we understand this. In our sexual harassment policies, all the people listed as point of contacts are not even people that are correct point of contacts anymore, all of them. So, when we think back to the Me Too movement, if something did happen to someone and they wanted to go to someone and they went to our policies, they would have nowhere to go. But then we're forced to sign off on these policies saying we understand them and that they exist. And then they're held against us when things and disciplines are done. I have an email from HR that says, if you have a restraining order on someone in the building, notify your program manager. That same lady disciplined me and said, you notified your program manager, you have a restraining order.
Okay.
That's my time, I'll respect it.
Thank you. And again, just as a reminder, we appreciate you being here to speak your piece about what's important to you. We cannot take any action or have any discussion about it. However, we do have Bruce Wagstaff here, and the individuals you mentioned report directly to him. He's the executive in charge of countywide services. So I would suggest that perhaps you grab his business card and maybe you set up a time to speak with him in greater detail about what your grievances is and your concerns.
I very much appreciate that. Do you know where I could get his card at?
He's about to give it
Right
to
here.
you.
Thank you.
Thank you. Okay. Next item, please.
Item 28 is the request ratification of the proclamations of local emergency and local public health emergency for the novel coronavirus epidemic, COVID-19.
Good morning, Board Chair and rest of the board. My name is Steve Cantelmi. I'm the Chief of the Sacramento County Office of Emergency Services. And you have before you a request for ratification of our local emergency as well as our local public health emergency. The local emergency is something that I'm responsible for, so my request is for the ratification of that portion. The primary reason for the local proclamation is to ensure that we are able to manage the incident properly and have the resources available to us to do so. The proclamation essentially just opens up some avenues for us to better respond to this incident. It allows us to provide more assistance to the departments within the organization. It also gives us opportunities to get mutual aid to come into our region in the event we need those resources. And it also allows the county to take some additional measures that they would not normally take. They can write ordinances, and they can also assist with getting some of those resources made available to us. The Governor has proclaimed, as you know, and through that proclamation, he has also opened up the CDAA funding, the California Disaster Assistance Act, which does provide some funding that may be available to the local jurisdictions. we're not proclaiming for that reason. We're just making note that it is available to us in the event we do need it. With that, I would request a ratification of that proclamation.
Thanks, Steve. I appreciate you being here to give us a brief summary of what the action entails. However, I would just like to add, maybe I can just simply just prompt you to see if you can articulate it better than I can. But this, by no means, in terms of the proclamation, the action of proclaiming this an emergency, it doesn't necessarily mean to the average member of the public that there's an extra elevated threat or concern. I think sometimes the public might see, declarations and proclamations of emergencies, and they equate that with some elevated threat. So can you speak to that?
You're exactly right. This is more of a preventive or a trying to get in front of the issue. Right now, we're not anticipating having any additional needs in terms of mutual aid. This doesn't elevate the incident so that it is something more than it is. We're just looking to be ready and prepared to respond. So we're not anticipating using the mutual aid at this time. We're not even anticipating making any requests for funding. It's just to allow the county to be prepared in the event we do need to take additional actions.
Very good, thank you. Supervisor Tully.
Yeah, thanks, Steve. I guess question to you, and I know Dr. Bielensen's the audience as well, but as you kind of referred to it as an incident. Maybe that's just to speak in the emergency services world, but obviously this is a situation that continues to roll out on a daily basis. Obviously receives a good deal of media attention. It is cause for concern for a number of folks, a great number of folks, probably for a variety of reasons, certainly from primary health reasons, but also obviously economic and just daily life in our community. I guess my question is, though, is that in this declaration or proclamation, however you want to term it, that we talk about disaster assistance potentially being available to the state, maybe to local jurisdictions. But one of the questions that comes to my mind, because I think it will be increasingly, at least my sense of it is, something that people may be asking for, and that is the testing and who is bearing the costs of the test. I mean, there's been some inadequacies, certainly nationally, as it relates to the availability of tests, and more are on the way. And again, Dr. Bielensen certainly has been coordinating with our health officials on that. But those costs, if they're being borne by a local jurisdiction, public health is not a realm where it's solely just funding from state and federal. There's a local contribution to that. So in the event that there is a ramped up, and I assume there will be, because as a couple weeks ago we weren't doing any testing, and now we'll be doing and making tests available. But who's going to bear the cost of that? And if so, if we have to bear the cost through our health department, then I would assume that that's something we could claim against to allow us to do that sufficiently, but also recognizing that it's a cost that we did not anticipate, and yet in the realm of public health, I think we need to make that available, and obviously any other things that come with that if people test positive and so forth. So I guess that's my question to you, and I know Dr. Bielensen is standing to your left, but what's your sense, at least as the emergency coordinator?
Yes, like with all incidents or disasters, the cost is a burden on the local jurisdictions initially. They're responsible for the outlay of those costs, and in the event that it reaches a certain threshold with the state, it may be eligible for reimbursement. So it's important that all of us track those costs so that we can actually submit those costs in the event we do reach certain thresholds with the state. So at the initial point of this, the county is bearing that cost. Eventually, if we reach certain thresholds, we may be able to get reimbursed for it.
And if you know, what is the cost of an individual test?
I don't know.
Okay.
Perhaps
And,
Dr. Bielensen knows.
All right, and Dr. Bielensen may be able to answer that. But then I guess my other question is, before you leave the podium, so in the event that we have to mobilize, either through personnel to assist, obviously people have private health care providers, but not everybody is enrolled in a health plan, nor may not rise to that. But so the event that there's additional testing, but also dissemination of information, and certainly Dr. Bielensen and his staff have been, lead on a lot of that. But will we deploy, public health nurses to assist, in those realms, and/or other personnel? Again, we don't have a large regiment of, health officials that do that. And I guess my other question is that, as it relates to institutions and facilities that the county has, people in care and custody, that, how we bear those costs. Because again, what that means to public interaction, but also where folks are in confined situations, we obviously, provide different health care as we do, but also for testing and things that we maybe didn't anticipate. Any thoughts about that, how that's being handled?
Sure. Well, one of the things that the proclamation will allow us to do is we can use volunteers, and we can also use disaster service workers. Everybody that works for local government is a disaster service worker, so we're able to cover them under the Disaster Services Act. It gives them some protection in terms of health care in the event they're injured or in the carrying out of their duties as a volunteer or a disaster service worker. So that assists us. So that's one of the reasons why we would make this proclamation. There's other avenues in which this opens up for us to use in terms of volunteers. But at the end of the day, the local jurisdictions are responsible to provide that assistance. So if we exceed our ability to provide the needed staffing or that we would need here locally, then we would actually go out to a mutual aid and make those requests.
Okay, one other question for you, and that is that as public service provider, a large organization, we have dozens and dozens of public buildings, public facilities, and so forth, and obviously we employ in large part our own staff to do cleaning and to do other necessary items. I saw that somebody just brought up to the dais here some hand sanitizer, Purell. So are there costs if we does the county bear the cost if in fact we have a different regime for say doing door handles for extraordinary cleaning of restroom facilities, of where we have public gatherings, this facility for example, surfaces and so forth? Is that something that we try to track at least on a nominal basis so that we have some understanding of those costs in the event that we begin to reach some of those thresholds that you referenced? And if so, who's responsible for gathering that information, but also assuring that that's done?
Yeah, there's absolutely a potential to be reimbursed for those costs, and the need to track those costs are really borne by those departments that are responsible for doing that. So the county does have a system. Finance is assisting with tracking this information. So each department, though, is really responsible for tracking their own costs that are related to the event. And then at the end of the day, when the event is over, that's when you submit for your reimbursement, if you reach the threshold.
One final question for you then is, so we also contract with a number of parties for a variety of services, including, I think, food service, food prep, for delivery of other goods and products. Do we have anything that should this go to that proportion that allows us to assure that those that are in our employ, whether they be county employees, but also those that we contract with to provide other services to the public and or to county facilities, that they follow certain protocols and certain regimes? Obviously things are being recommended relative to hand washing, good cleanliness and sanitary practices. But in the event that we get into another situation that this grows beyond what might even be expectation relative to disease spread, do we have the ability then through through OES and or through the health officer to make sure that we can have confidence with those not only that we employ, but those that we contract with will follow certain protocols?
Yes, the best practices are to capture all your costs, track them, and submit them, even if you don't know whether it's an item that can be reimbursed for. That's a decision that will be made later by either the state or the federal government if they were to declare. So we've actually delivered classes, training for the departments and the stakeholders outside of our county to learn how to track those, what's important to track, and how you do that. We have actually a class coming up here in about a week to help reinforce those practices that are used nationwide in terms of how to track costs and what are the best practices. So I'm confident that we as a county can do that fairly well. I can't speak for the cities or the other jurisdictions out there, but they have had opportunities to be trained.
Okay, but I'm not just so much tracking costs, but I'm talking about the oversight that assures that, whatever may have not been anticipated in the contractual relationship, do you coordinate through that, or does that come through Dr. Bielenson and public health as it relates to direction to those that we do business with?
If it's something that is contracted or directly related to a public health department's request, then they would be responsible for tracking that. Each individual department is responsible for tracking any resources or any costs that they might have, and then that is all gathered and provided to us, and we assist getting that information to the appropriate state agencies for that determination as to whether or not they would be eligible for reimbursement.
Okay, thanks.
Supervisor Peters?
Thank you. I had a question for Dr. Bielenson. Thank you, Chief. Thank you. The new press release that went out yesterday talking about shifting the effort to mitigation. I've read it, and I've read it to several people who ask me, and I think people don't really understand why. And so I guess you aren't using the word quarantine anymore, but you're still asking people to go home if they feel they have the virus.
Sick.
So maybe
Correct.
a little more detail on that.
So yes, so we're moving from containment, which is contact tracing and quarantining people, to mitigation, which is trying to reduce the risk to those who are at most risk from this disease, which tend to be seniors and those with chronic underlying conditions. The key is to try and keep those folks from encountering people who have the disease so that they don't get it. That's the big effort.
So why shift out of the 14 days? I'm trying to...
So we're not going to be quarantining. So the answer is we're not going to be quarantining going forward, with few exceptions. There are a few exceptions, potentially people who are, and by the way, we've been working with the UC system, the 5 schools in Northern California, to go over, so we're having similar guidelines. So if there's a healthcare worker who's directly taking care of a sick patient who coughs on them, we might quarantine them until we test them. But in general, people are going to not be quarantined. They'll be...
So you're getting rid of the blanket quarantine,
Correct.
more or less, and going more to specific
Correct, and the rationale for that is that there has been community spread. Now, you may say there are only 11 cases, because we have 11 cases so far with 1 recovered. But the answer to that is, to Supervisor Natoli's point, that we've had very little testing available until, actually, as of still today, we only can test 20 people a day. So we've been testing 20 people a day for a few weeks, and so that's like 160 people, or a couple weeks, so that's like 160, 180 people that we've tested. So if 10 of them are positive, that's, a sizable number.
So because you're adding additional labs, you have the ability to
we
test
will
more.
be adding additional labs when LabCorp and Quest come online. Right now, they're really not online, despite that they've been said that they would be, and that when they come online, we actually have to send the swabs to North Carolina. So it's going to delay some period of time. So even when we get LabCorp and Quest later this week, there will still be a delay in the response time. To Supervisor Natoli's other question, one of several questions.
Right.
Those tests will be done through their doctor's offices. The 20 tests a day that we do will be for high-risk people, seniors, et cetera, that have significant symptoms, or hospital workers. The others will go through their doctors. Once this kind of gets up and going, LabCorp and Quest, which is what you use for any lab test that you have, right? It'll be prescribed by a doctor, if you will, and the test will be done and sent off, and then the healthcare costs. Those costs will be borne by either the patient or, depending on what the governor has done, the state.
And did you say when you thought those labs would be coming on board?
we keep hearing every day
Okay,
what's happening.
momentarily.
Yeah.
If I could, I'd like to, if Supervisor Peters has concluded her questions, I'd like to put a finer point on it. I think we're all in receipt of various emails from constituents that landed in our inboxes late yesterday following the message that we're moving into a mitigation phase. And I don't think any of us welcomes the fact that we're thrust into a context now where it's a very technical, medical, clinical environment in which we're trying to explain things, but none of us is a medical doctor. You are, and we have, a very capable staff that really understand the science behind this and how best to contain and to deal with the virus. I would like for you to work with our CEO to see if there's any opportunity maybe to carefully word an explanation that our offices might be able to use in response to some of those concerns that are expressed by our constituents that explains the mitigation part, because I'm not sure that without that we can put to rest some of those fears. And then believe me, the words that are being used by some of the emails that I'm receiving, the people that are emailing us, they're very, very concerned about this move without understanding it.
Yep.
So we are in process working with Dr. Bielenson and his staff on FAQs, and we'll have that on the website about the mitigation, so that'll come out shortly.
Okay, great.
And also Dr. Bielenson has press availability starting at 10:30 today. Same time questions we're getting to get that message to the media too.
If
Okay,
I could,
yeah.
sorry, go ahead.
No, go ahead.
If I could, without sounding like I'm trying to
Could you speak up a little bit, Dr.
Sure.
Bielenson?
Without trying to underestimate what the issue is, or undercounting what the issue is. In 25 years of being a public health official, I've dealt with this.
Hey, Flo.
Can you raise?
I've dealt with these things every 4 or 5 years, and I'm sure that Supervisor Peters and Supervisor Natoli have as well. Thank you. There's H1N1, there's West Nile, there's SARS, there's MERS. Every 4 or 5 years, a new virus, and it's always a virus. Why? Because there's no antibiotic for it, because antibiotics only treat bacteria, and there's no immunization available because it's a new virus. These viruses come out with a bang because people die of it early on, because only the sickest tend to go into the hospital or into their doctors and end up and the mortality rate is high to start with. And what always happens, which is already happening with this virus as well, is that the mortality rate, the number of deaths over the number of cases starts out high, but as more and more people are tested, and they're tested and they come back positive, but they're mild or no symptoms, which in the international data to date, 81% of all cases are either mild or no symptoms, that the death rate goes down dramatically. And within a few months, an antiviral medication is developed, and within a year, an immunization is developed, and this becomes part of the constellation of infectious diseases that go around the world in a seasonal manner every year. Perfect example is H1N1, which is now one of the flus, and we have an immunization against it. So without understating the problem, the mitigation, and to Supervisor Cerna's point, is predominantly to try and protect those who are most at risk. With all the data shows that those most at risk are senior citizens and those with chronic underlying conditions. And so we're trying to protect them through our efforts as much as possible. On the other side of the coin, there's usually a U-shaped curve of how people are affected by a flu-like illness, where the very youngest and the very oldest. In this case, the youngest are not seeming to be affected at all. Virtually at all. The rate of infection is the same. In other words, they're getting infected at the same rate, but they're symptomatically not showing symptoms. And so that's one of the reasons that we're recommending for school kids, as well as for any adults who are younger than senior citizen age, that they follow basically the protocols you would follow for the flu. If you're sick, stay home. If you're really sick, call your doctor in advance so that if you have to see the doctor, they have prepared a side entry just so like you don't go into a doctor's office with the flu. And if you're really, really sick, you go to the hospital. And we're trying to do that to protect our hospitals and our emergency rooms from being overloaded when we already have other issues that they should be used for.
I wasn't quite finished. Yeah, thank you. So I'm glad to hear you have a press availability at 10:30. I think that will probably help a lot. And would encourage you to come up with a really easy to understand response on this mitigation versus containment, because it's hard for people to understand.
Does the senior citizen thing not work?
Pardon?
Does the senior citizen thing not work? I'm asking you.
Yes, for me, but I've been hearing about this for 2 weeks, so I'm not sure that people who haven't.
No, we'll make sure that it's easy to understand.
Yeah.
Absolutely.
You're very good at not sounding too much like a scientist, but you are a scientist, so you need to get a layperson to understand what your comments are. And then one other question was, people who test positive but are asymptomatic, does that give them immunity the next time it comes through?
Very good question. I actually went online this morning because I've been saying that, and I've been trying to confirm that, and it appears to be true at least for a period of time. You would think that it would be, but because the viruses mutate fairly frequently, it may not be 100% true, but it is true initially. So if someone tests positive, they're not going to get it in the next few weeks or next few months.
Okay, thank you.
Supervisor Frost.
I'd just like to add a little bit to the containment versus mitigation, containment to mitigation conversation, and just say, I'm getting calls and emails about this too, and people are concerned that we are moving out of quarantine, and I'm wondering if we can message it in a way that says that we're at that point where if you begin to feel symptomatic, you self-quarantine. That's part of the mitigation protocol.
Yes.
So we're not really they have the impression that we are disregarding the quarantine and that we are basically setting everyone up for a catastrophic problem. So
that's a good point.
So maybe it's just a way of saying, instead of we're moving out of quarantine, we're just we have so many people. It's getting to that point where we need people to self-quarantine, and teach them the symptoms so they know what to do at what point. And then I wanted to also mention that I have some communications regarding people, some of our population feeling discrimination around, people are no longer going to the Chinese restaurants. I know that there will be an economic impact, but is there a way that we can include in our communications that this is going to be difficult for a period? It won't last forever. There are many businesses that may be impacted. You're not singled out. No one's being singled out. In fact, it's not just our Chinese community. A lot of people may not go anywhere for a while. They may stay home. Just include that in our messaging so that we can put their, people are nervous and we want to put them at ease. And then the other thing I wanted to ask you about is the local labs versus North Carolina. Are we going to bring it locally as this begins to expand? When are they coming here with that test?
Very good question. I meant to do that. So first of all, the lab tests that we have available now at Sacramento County, we're one of only 14 counties, 14 or 16 that have them. They're at our Sacramento County Health Center, our FQH, our Federally Qualified Health Center. We do 20 a day. Those are our own, and we do our own testing. But that's only 20 per day. The LabCorp and Quest, which will be doing much more, many more tests, will eventually be able to locate here. But for right now, we're having to send them to North Carolina. Well, when we get them, we'll be sending them to North Carolina.
And so, okay, 20 a day isn't, so, I
No,
mean,
it's not.
we need to be able to do all that we need to do. So when is that, so,
We're told any day.
Okay,
This is
okay.
coming from the CDC.
sorry,
and
I
the
was,
federal.
my mind was wandering.
No.
And can you give us some messaging on at what point do you stay home? What are the symptoms and at what point, so that we can help people understand at what point is it prudent
So
to self-quarantine?
The primary symptoms are fever, cough, and shortness of breath, which obviously is similar to flu and other illnesses, which is why we're encouraging people to do what they would do with the flu. It's actually, even for seniors, this is like a significant flu season. If you have, whether you're young or old, if you have symptoms, stay home, avoid contact with others, and as much as you possibly can. If you're really sick, call your doctor. If you're really, really sick, go to the emergency room or a hospital.
Thank you, doctor.
It's somewhat like if you have the flu, the regular flu.
Yes,
You
it's
stay home if
exactly-
you don't
it's
feel well.
Exactly.
Call
That's
the doctor
exactly
if you
what
feel
we're-
worse.
It's the same virus. It's a similar virus. It's the same respiratory droplets, and it has the same symptoms, and it affects most seriously the seniors and those underlying conditions. And just so you know, to put in perspective for your constituents, this year there have been 29 million cases of the flu, 240,000 hospitalizations, and 19,000 deaths in the United States alone this year. So that keeps it in perspective, because we've had this in our community for quite some time now, and they're not huge numbers of people dying.
Supervisor Tully?
Yeah, thanks, Dr. Beavis. I just wanted to follow on a couple of questions. One, back to the testing. So we're able to do 20 a day. How do we prioritize who gets tested? And the second part of the question is that when things are able to ramp up any day now, what's going to be the capacity at that point in time? Is it going to be 100? Is it going to be 1,000? What is our capacity?
We think more like 1,000, but again, we've been told by the CDC things, and we haven't seen them in actuality. In terms of the 20 that we're doing, we triage the people. We do it with healthcare workers that are actively on the front line and seniors who have significant illness. Those are the two that we do now. We don't test the average person. Like if any of you, had if you did, we probably would test you. If I had the illness, I would not get tested. Whereas once we go to what's called Tier 3, it'll be available to anybody who wants it.
And when you say anybody who wants it, so they have to go through their healthcare provider, or they could come to the health department?
No, they have to go to their health provider first.
Okay, but if they don't have a health provider, I mean, most folks do now because of the coverage, but...
Most, they can go to the FQHC.
Okay. And we say any day now, and that information is coming down from the
Center for Disease
CDC, but what if the demand was there? You triage the 20, but if the spread... That's it. We're limited to 20. So even if we had 40.
With mutual aid, the other counties are already full as well. So
okay,
there's nothing to do.
So the question, until they get ramped up here in California, whenever that is, what's the turnaround time to? I assume you do overnight or overday to North Carolina, and you get it back. Did they report it back to you? How is that? What's the turnaround?
So in our own tests, we can turn them around in several hours. The 20 that we do ourselves, and the LabCorp and Quest, which I don't believe are even online yet, if they are online, but it'll be about a 4-day turnaround, right? Because it's a day there, a day back, and then 24 to 48 hours.
So
but to be honest, in many ways it doesn't really matter anymore if we test, right? Because we're going to self-quarantine if people test positive. If people have signs or symptoms, they would self-quarantine. You don't need to quarantine for 14 days anymore, though, by the way. And if you test positive and you're asymptomatic, you go about your business. If you have, if you test positive and you have some symptoms, you stay home. If you test positive and have significant symptoms, then you go to the doctor. So it's really doesn't matter terribly much if we test or not anymore.
So without diving too deep, doctor, oftentimes, though, folks, before they know they're sick, they already are. So is the contagion immediately there if someone who's contracted it, but may not even know that they got the symptoms until they start feeling a bit peaked or whatever. So
incubation period is 2 to 14 days. You can be shedding virus without having symptoms. In other words, you can be contagious without having symptoms. You're most contagious when you have symptoms. But that because you can shed virus without knowing you have symptoms or without knowing you have the disease, that's the whole reason for containment versus mitigation right now. It's been spread around, and I would venture to guess, if I had to, that at least one person in this room has had it.
So, with that being said, I appreciate sort of the calmness of the approach, and I think the very thoughtful, I think references you make on, perspective on this, but nonetheless, obviously this receives round-the-clock coverage in the media, and I think with some of the events in the community over the last few days, I think risk and exposure and all those things, and you look what happened internationally, and in Italy and other places. So my two more questions. So one is that are we doing anything different as relates to guidance for public facilities? Again, Supervisor Frost and others have referenced the interactions, people going out to eat, going out to public events, and we see Santa Clara declares yesterday, their county, that anything gatherings over 1,000 prohibited. So those types of things send messages to others, and so what's the guidance that you're receiving, but also that you're giving both for county facilities, but also other public facilities?
Yeah, so on a variety of issues. First of all, 1,000 doesn't really make sense, right? Because if there's 850 people, that's okay, but if there's 1,050, that's not okay. So that doesn't really make sense. The biggest thing, again, in terms of mitigation, trying to reduce the risk to seniors, is actually if you're going to have a senior conference of seniors or an AARP conference or something like that, and there are 50 people coming, I would recommend probably not doing that. If there are 1,000 people going to Golden One for a high school basketball game, that may be a different story.
Can I interrupt? Yeah. We know that you need to get with the press. You're T-minus 8 minutes here. However, on that point, I just want to get this in. What are we doing to communicate with the most vulnerable population, which you've stated many times, which is our elderly population, in coordination with the Area 4 Agency on Aging?
So we give, as far as I understand, we've sent out all our information.
Can you speak up, please?
We send out all of our information to the Office on Aging.
That's correct, but Supervisor, we can circle back with them today to see if they need anything more.
Well, that seems the logical conduit to.
Yes.
Absolutely, and there's others too. I think there are
We've been
others
meeting
too.
with nursing homes and all sorts of things.
So all our information is going out to them. I think we are going to renew the efforts to make sure you got this information. What else do you need? What can we do? Right. So that we'll take that advice.
For example, nursing homes now, I visited several of them. They all have this guidance up on their front door.
Gotcha.
And I would just say in-home supportive services. We have caregivers who a lot of times are offering personal care. They're, some of them may have, limited English-speaking abilities, and I do think it's important beyond, just what would be typically in the English language, is make sure that working through IHS, public authority, to the folks who are caregivers, that we get that information out, because again, those are largely individuals or small groups that are being tended to by those caregivers, but different than skilled nursing facilities or other acute care facilities or board and care homes. But I think that that communication, where again you have vulnerable populations, whether it be elderly or maybe already compromised health-wise, and where exposure could be very risky for them. One last question then, and certainly a thank you for your work with the Elk Grove School District. I know that as recently as last evening that I met with folks and with the County Office of Education, coordinated a meeting with the superintendents throughout the county. I would also ask that in addition, I know you've briefed the City of Elk Grove folks as recently as yesterday. I think it's important that to our other city leadership and all the incorporated cities in the county, obviously City of Sacramento and City of Elk Grove have been tuned in, but I think we need to make sure that maybe now through you, calls to city managers and offer information beyond what obviously is being made available, but if they need to have a briefing for their leadership in their city, because again, they employ folks that are in contact with the public, they have sanitation workers, they have folks going to people's homes, they have folks in the public works realms and so forth. So I think if we could make sure that our partners in leadership.
Which they are. We have a whole process through Steve's operation where there's been communication, the PIO's been in conversation, everything that we've been putting out, they've been picking that up and sending it out to their employees. So we'll keep that effort going, but I just want to assure you that that process has been in place for a couple of weeks now.
Okay, but you've offered briefings to the cities if
No,
they'd
I've
like?
not offered briefings, but through Steve's folks, we have given them the information, and I think it goes without saying, but we'll double check with them. If they want a briefing, we'll brief them, but they have the information, and a lot of close contact with our PIOs, their PIOs, what information, so that avenue is there.
Okay.
And I'm watching the clock too.
One final question, or comment about private schools. Public schools have, a certain realm in administrative structure, any number of private schools. So make sure we get information out to those institutions as well. Your Montessori's, and your daycares and others. Even though it sounds like some of the younger population may not have the same risk factors, although we identified some with positive tests here in the county. So
I've dealt directly with several of them, and we've also put out our information. But I've actually talked specifically to several of them.
Okay, thank you.
Supervisor Frost.
Dr. Bielenson, can you please speak to our homeless community members and the impact on them and how we're going to deal with that? And does it impact our communities as far as contagions?
Very good question. So as of right now, there are no known positives. Granted, we've only tested about 160 people, so you probably wouldn't have picked them up. We looked at doing questionnaires to put on the street or on the parkway in terms of symptomatic people having symptoms, but so many of them have these symptoms that I've already described that it probably would be overkill. So we're doing several things. First of all, the outreach workers and navigators from Sacramento Covered, from DHA, from Sacramento Steps Forward, et cetera, are all going out and doing kind of mini exams on people. Secondly, we've gotten hand sanitizer in terms of 2,500 or 3,000 of them, which were hugely price gouged, by the way. We were able to negotiate down to only $1 an ounce, but they were going for $8 an ounce, which is outrageous. And our hand sanitizer is coming this week, which was good. And that is useful. 60% alcohol is useful in terms of, because obviously the hygiene and washing your hands is not available to a lot of the homeless folks. Secondly, if there's anyone that's sick that needs to, in this case, would sort of quarantine, because otherwise they can't stay home. Right? We have motel rooms throughout the county, throughout all the districts, that we use like for TB and other types of things regularly. So we have those available, and because of this announced declaration, we're able to get more if we need them. And then thirdly, if they're ill but not really sick, they stay there for a few days, and then they be released. If they're sick and they have symptoms, again, they go to the doctor, and if they're really sick, they go to the hospital emergency room.
So at this point, instead of having the press conference here at the podium, I would like to let Dr. Bielenson go have his discussion with the media, who is obviously showing up here precipitously. So if there's no further questions, I think that's probably the best thing to do at this point. Okay? Thank you. Appreciate it.
Thanks, Dr.
Thank you.
Supervisor Cerna, you need to have someone make a motion.
Right. Thank you.
Second.
Okay, it's been moved by Supervisor Frost, second by Supervisor Tolley. Please vote.
Unanimous vote.
Thank you.
Okay, item 29 is the public hearing on the benefit category change and levy of increased service charges for the Gibson Crossing subdivision within Zone 1 of County Service Area Number 1.
Good morning, members of the board. My name is Dorothy Kodani, and I'm a senior civil engineer with the County Engineering Division. And this is actually the first of 3 items that I will be presenting to your board this morning. This first one concerns the Gibson Crossing subdivision, which is on the north side of Alberta Road, approximately 1,000 feet west of Watt Avenue. The tentative map for the subdivision proposes 162 residential lots and a park parcel. And in response to entitlement conditions of approval, a request was submitted to initiate the benefit category change for County Service Area Number 1, which provides street and safety light services in the unincorporated portion of the county. Therefore, a notice and ballot were mailed to the property owner on January 24th. And this development is comprised of 2 parcels currently. Parcel 20300500056 is currently in the safety light only category with an annual service charge of $2.56, and parcel number, which ends in 036, is classified as an irregular or miscellaneous parcel, and it is too small to be currently assessed. The proposed benefit category change would change the category to the enhanced street and safety light residential category with an annual service charge of $49.64 for the 162 proposed residential lots, and for the 2 non-residential lots, it would be proposed to be $327.04 for an annual charge based on current fees, or current rates, excuse me. So if there are no questions of the remaining members of the board, we recommend that the public hearing be opened, considering all written and oral testimony and objections and protests, close the public hearing, and direct the clerk to tabulate the return protest ballot.
Okay, and at this time, I do not see any questions from the board, and I have no questions, so at this time, I'll open the public hearing. And I do not have any comments from members of the audience, and so close the public hearing, and we'll tally the voting.
So we have 1 ballot. The legal owner is Gen California 12 LLC for the parcel numbers that Ms. Kodani had read into the record. The site address is Alberta Road, Antelope, California, and we do have a vote in favor.
So,
yes, thank you, Flo. Thank you, Supervisor Frost. So since there is no majority protest, we request that the board adopt the attached resolution to approve the benefit category change. And as far as the fill-ins in the resolution, I can read those into the record. Section 2 of the resolution, at the close of the hearing, the board had received 0 written protests, which the board finds and determines to not constitute a majority protest. Section 3, at the close of the tabulation, the board had received 1 protest ballot, totaling 100% of the total service charges to be levied, of which 100% was in favor of the benefit category change and 0% was in opposition to the change.
okay, so since this is my district, I'll move approval, and seconded by Director Peters, or Supervisor Peters, and please vote.
Unanimous vote with those members present.
Thank you.
Thank you very much.
Okay, and then we have another one for item 30. This is County Service Area Number 10, Benefit Zone Number 3, the public hearing on establishing a service charge within the Hedge 22 subdivision.
Good morning again. Dorothy Kodani with the County Engineering Division. And the Hedge 22 subdivision is located approximately 2,000 feet north of Gerber Road and west of Waterman Road, and it proposes 22 residential lots. And in response to a rezone condition of approval, a request was submitted to initiate the establishment of a service charge for County Service Area Number 10, which provides trip reduction services. So in response to that, a notice and protest ballot were mailed to the property owner on January 24th. And this item proposes the levy of an annual service charge of $112.68 per single-family residential lot. So again, if there are no questions from your board, we recommend that the board open the public hearing, consider written and oral testimony and objections and protests, and close the public hearing, and then direct the clerk to tabulate the return protest ballot.
Seeing no questions, I'll open the public hearing, and I have no requests for comment or hands raised in the audience, so I'll close the public hearing, and we will count our ballots.
Okay, and again, we have one ballot. And the legal owner is Hedge 22 LLC for the site address at Hedge Avenue for the parcel number that Ms. Kadani read into the record, and they are voting in favor of the increase.
Thank you. Since there is no majority protest, we request that the board adopt the attached resolution to establish a service charge on the Hedge 22 subdivision. And again, we can read into the record the fill-ins in the resolution. Section 2, at the close of the tabulation, the board received 0 oral and written protests, which the board has duly considered. Section 3, at the close of the tabulation, the board received 1 protest ballot totaling 100% of the total amount to be levied, of which 100% was in favor of the service charge and 0% was in opposition to the service charge.
I move staff recommendation.
Motion by Supervisor Natoli, seconded by Supervisor Kennedy. Please vote.
Unanimous vote with those members present.
Thank you again.
Okay.
Item 31.
And this will be a, well, I'd like to make a note. There's a correction to the supervisorial district. This is residing in Supervisor Natoli's district. The record had Kennedy and Cerna, but this is only for Natoli in his district. This is the public hearing on the formation of Benefit Zone Number 4 of County Service Area Number 10 from Benefit Zone Number 4. Approve engineer's report, state the intention to levy service charges, and direct the clerk to mail notices and protest ballots.
Thank you again, Flo. Good morning again, Dorothy Kodani with the County Engineering Division. County Service Area Number 10 was formed in May 2003 to establish a financing mechanism for trip reduction activities. And these activities can include shuttles, van pools, and promotion of travel alternatives to area residents, employers, and schools. Benefit Zone Number 3 is currently the only active zone within the unincorporated portion of Sacramento County and encompasses the North Vineyard Station, Florin Vineyard, and Wild Hawk North planning areas. The Easton development is located on 8,500 acres owned by the Aerojet Corporation and is conditioned to annex to County Service Area Number 10. Due to its location, it's actually proposed to form a new benefit zone, which would be called Benefit Zone Number 4, to accomplish this annexation. And the proposed budget for Zone 4 includes a community shuttle and a transit subsidy for residents and those wishing to utilize the services within proposed within the zone. The proposed annual charges, as detailed in the documents that have been prepared for you, include $165.62 for single-family residential dwelling units, $94.41 for multifamily, per 1,000 square feet for retail and commercial service areas, $233.53, and for office area per 1,000 square feet, $193.78. Again, if there are no questions from your board, we recommend that the public hearing be open. Again, testimonies, objections, and protests be considered, and that the public hearing be closed at that time.
Seeing no questions, this public hearing is open, and seeing no comments or cards, the public hearing is closed. And if you would please...
There's actually no ballot for this one, and so...
No, okay, so...
So I would just request that, since there are no protests, that we adopt the attached resolution to form Benefit Zone Number 10, Benefit Zone Number 4 for County Service Area 10 without an election, to approve the engineer's report, state the intention to levy service charges, and direct the clerk to mail notices and protest ballots.
Move staff recommendation.
So moved by Supervisor Natoli, second by Supervisor Kennedy. Please vote.
Thank you for the easy morning.
Unanimous
Thank you.
vote with those members
Thank you,
present.
Dorothy. Well executed. And next item, please, moving on, as Board of Supervisors and Sacramento County Public Utilities Financing Corporation.
Is the approval for the issuance of the County of Sacramento 2020 refunding certificates of participation, all corresponding documents and actions.
Good morning, members of the board. I'm Colin Bettis, the county debt officer. The item before you this morning is a standard bond refunding in which you are asked to act as the County Board of Supervisors and the Board of Public Facilities Financing Corporation. Materials relating to the estimated savings and the form of the documents associated with this transaction are included in the board letter and attachments. The financing team and I are available for any questions you might have. Thank you.
Supervisor Natoli.
Yeah, again, I think it was outlined in the staff report, but Colin, if you might just take a moment and explain, I think, again, for those that may be tuning into this meeting and not here in the chambers, what this will result in. Obviously, it's going to be in refinancing some of the certificates of participation, but it also, we're going to capture some of the lower interest rates, but what the savings are, what the, what the offset is to the general fund versus what would happen if we didn't take this action, at least as contemplated. So if you could just take just a brief moment to do that, I think it'd be
absolutely.
helpful.
So current estimates are that the additional need from the general support to pay the debt service on the current bonds would grow from approximately $3 million next year to about $5 million towards the end of the debt service period. The estimated savings on this refinancing is about $2.2 million per year, which will reduce that need for the general fund to support additional debt service.
And there's 9 years remaining?
That's correct.
So for what this ends up doing is that given the financial issues that we're having, if this financing goes through, given the volatility the market's having, that does alleviate some of the pressures that we were going to have to put more net county cost into it. So for us, this is very positive if the market stays where we need it for it to stay.
Yes.
And just one follow-on, Nav, and it was in the report, but related to coming from 1999 forward relative to the fixed asset acquisition fund, which is, a pooled account to help departments with certain acquisitions and the financing that stands behind that. So what would, if I understand that when we allowed departments to tap that fund through the budgetary process, that they didn't take into account the interest going forward, and so that's what's resulted in this general fund increase in contribution, or what?
So if I could respond to that,
Yeah,
portions of it were in that there was an allowance for those departments to pay back those loans early without paying the additional interest. The bonds that we had issued had a call date 10 years out, and so if the departments had paid down that loan earlier, then they wouldn't have been paying on that ongoing interest. And so then that would have caused the general fund to have a greater portion of the responsibility.
And that wasn't known to us from a budgetary.
So if the department would have, if we had the ability to call all the bonds when the department had prepaid that loan, then we would have called the bonds and not had that ongoing debt service. Yeah.
Okay.
So it was a timing mismatch that we got into. So we've been trying to fix that ever since we found that issue was out there.
So in the event that we were to bond in the future for that particular aspect of support for departments and acquiring equipment and asset development, then we would look at call dates for payoff. Are we going to build in interest or what?
Yeah, we would look at it. I think not being here, but I think I can sort of speculate what the decision got made. If the term of the loan was more generous in payback, it was easier for departments to pay back. So we would have to, if we get to that spot that we issue debt for that, we would look at both the call date, we'll look at the final maturity date, and have that discussion almost on an annual basis with Colin's group to see how the payments are coming and do we need to recalibrate. Part of this, when we hit 2009, 2010, at that point, a lot of these payments and things we had to be redone because the departments, either you pay back this or you're cutting services. So we got into that conversation. So we learned a lot from those years on how some of these things were structured, but we'll have to look at both dates as we go forward.
Well, if I recall correctly, we were covering the sheriff's portion of this several years in the general fund through the other departments, if is that correct?
We did the sheriff, we did animal care, and there might have been one more, but I think those are the two that stick in my mind.
Right.
And then we finally flipped it back to the general fund.
Right, because it was like $5 million a year, if I recall.
Yeah, pretty close. I think sheriff was like 4, animal care was 1.8, so 5.8 million.
Right, yeah, okay. All right, thanks, Mr.
Thank you. No other questions, and I want to thank you for working on saving us money. That was a great move. Motion by Supervisor Peters, second by Supervisor Kennedy. Please vote.
Unanimous vote with those members present.
Okay, and moving forward as Board of Supervisors and Housing Authority of the County of Sacramento. Next item, please.
Item 33 is the Pacific Rim Apartments, approval of final tax exempt bonds and loan documents.
Second.
Moved by Supervisor Kennedy, second by Supervisor Peters. You got off easy today. Please vote, unless someone has questions.
Oh, I have something to read into the record regarding the Housing Authority resolution.
Sorry, we got ahead of you.
In Section 9, the bonds will be registered rather than authenticated in the second sentence. And in Section 10, we are adding authority to terminate the existing bond regulatory agreement. Given a new bond regulatory agreement, we'll extend the term of affordability for 55 years.
Okay.
Still second.
Okay, well, we have a motion and a second, and comments by Supervisor Natoli.
Just a question, so the difference between being registered and authenticated, please offer that distinction. What's
Yeah, we have bond counsel here, Paul Tolan from ORIC, and he can help answer that important question.
Okay.
Thank you.
Good morning, Paul Tolan from ORIC. The difference between registered and authenticated is associated with the structure that we're using. In a pledge and assignment structure, the bank operates as both the lender and also as the agent for the issue of the bonds. So there's no separate fiscal agent or trustee, and so the bank would take the bonds and then register their ownership as opposed to a trustee who would authenticate the bonds on behalf of the bondholders. So it's merely a technical change and a typo on my part, for which I corrected.
Okay, good. Thanks, Paul. Okay.
Thank you.
Thank you.
Thank you very much. Well, so,
Hours for explaining these
so we have a motion and a second, so please vote, please.
Unanimous vote with those members present.
Thank you.
Okay, and that concludes our morning, and so at this time we adjourn to closed session, and we'll return at 2 p.m. Oh, we can do appointments. Yes, thank you. Good idea. Let's move forward to appointments.
That would be item 37. Okay, so you are continuing to April 21st, the Assessment Appeals Board, County Service Area 4B, Slough House, Wilton, Casumnes, County Service Area 4C, Delta, and the Southeast Area Community Planning Advisory Council. For your items today, you have the, is someone going to be doing the chairman's?
You have the notes for Cerna?
I do not.
I
sorry.
do.
You do? Okay, and I have some notes as well.
Okay.
Okay.
Do you want to just go ahead and do it?
Yeah.
Okay. Or did you?
Are you on adult and aging?
Yes.
Yeah, the chiefs recommend April Carney and nominate Preston Romero to the general public seats and continue the remainder April 7th.
Okay. And then we have the Children's Coalition,
Continue to April 21.
Cordova Community Planning Advisory Council,
And March 24th.
Equal Employment Opportunity,
Continue to April 21st.
Fair Oaks Community Planning Advisory Council,
I'd like to nominate Ron Lee and request the process be waived.
Please vote.
unanimous vote with those members present.
The remainder to April 21st.
Mission Oaks Recreation and Park District,
Nominate Patty Todd. for the District 3 appointment.
Okay. Natomas Community Planning Advisory Council.
That I don't have.
Okay, I have notes to appoint John Casillas, Mariana Sabanayo, and Sheila Ellis, and forgive me for butchering the names.
Say that again.
3 times.
Okay, then we have the Recreation and Park Commission.
For me, continue to March 4th.
Okay.
March 24th.
Sacramento County Bicycle Advisory Committee.
Continue to April 7th.
Sacramento County Mental Health Board. Supervisor Natoli.
Yes, nominate Teresa Rivera for the family member seat.
Okay. And then Mr. Kennedy for SAC Housing and Redevelopment Commission. And finally is the Sheriff's Outreach Community Advisory Board. Supervisor Peters.
Nominate Robert Olmsted and request the process be waived.
Okay, please vote.
Unanimous vote with those members present.
Thank you very much. And there being no business remaining, we are adjourned to closed session and we'll return at 2 p.m. Thank you.
And we're going right now